What's going on, guys, girls? Welcome back to another video in your sideline and prone certification course. So we've done lower body, and as we work our way up to the shoulder, we're going to go with just some basic hip tilts. As we work our way up from the calf to the hamstring, we've done our prone leg hinge, we've done our hip flexor, deep hip flexor stretch work. We're going to go up to hips, lumbar, and rib cage area. So I'm going to have Mike just relax his arms to the sides. We're going to be on the opposite side of the body, and when I reach across, I'm going to come under that ASIS. So the front part of that hip is what we're looking for with our anchor point. So you can start just by placing the hand on the sacrum and just starting to shift the hips. This is essentially what we're going to do, but we're going to add a lift, and our other anchor is either going to be more of the spinal erector QL, or we're going to pin the posterior part of the ribs to help create some separation with this lift and slight rotation. So we're going to come under. My right hand comes under. We find that hip crest, okay? Fingertips can go right under that hip for a nice little hook. If they're ticklish, you may not be able to get into that hook. That's okay. You have to listen to the body. You can just kind of anchor without hooking under into that hip flexor tissue. So we've got the hip anchored under that ASIS. I'm going to start by just adding my left hand to some pressure. So I'm going to just start to roll and lift the hip. And then I'm going to pressure back down with my left arm, rolling that hip the opposite way. So we're going to lift, pressuring down. Okay, so I'm on the sacrum right now. Now as I shift my left hand up, it's going to be more of this opposing side QL. So we're going to press in, we're going to lift, and then we're going to come back down. So still the philosophy of gentle glides. I'm pinning and then I'm gliding that tissue in either direction, okay? We also have pin on the same side to really kind of keep the ribs down and open up this low lumbar QL component. So I'm going to pin more at the lower floating rib, start to lift. You can see he has less range of motion because the ribs are coming out of the equation. And then we come back down, okay? So we can spend a few minutes just kind of working to open up this tissue. I can add the downward pressure to create some lumbar distraction, all right? Or we can pin straight down towards the table, or we can glide that tissue either with or away from the lift. So we just have this, and we can add a little bit of a lean down as I take some of that bigger part of the movement to open up his lateral line and those spinal erectors. And as we rotate the hips this way, we're getting that spiral line which goes from this hip to the opposing shoulder, okay? And that anterior sling. All right, so we're going to do that from both sides, testing, assessing which side feels tighter, which side feels more restricted, which side might feel looser, and then we're going to continue to work our way up to that shoulder for the other movements in the other videos. All right, guys, thanks for watching. Catch you in another video.